Kish with HealthIT TV. I'm here at HIMSS2016 with Farzad Mostashari, former ONC director, now CEO of Aledade, helping independent physician practices move towards ACOs.
Yeah.
So you're really seeing this from, I mean, you've got vast insights, as we were just talking about. I think originally you said meaningful use was intended for value-based care. And now, of course, we're at HIMSS2016, 7 years down the road now, and we're, meaningful use is on a little bit of shaky ground, but all the talk now is about value-based care and how we make that transition. So how's that transition been now that you're seeing it from the vendor and the provider side?
Yeah. I mean, for me personally, it's been incredibly gratifying to see what we had hoped would happen, which is that there is a tiny window carved out of our healthcare system where what's good for the patient and good for the doctor is also good for society, right? And in order to accomplish that, from the very beginning, we said you need a technology infrastructure that we don't have or we didn't have, right? We said you actually need to make payment systems be different, where you're not rewarding people doing more, you're rewarding people keeping healthy.
Right.
And the third thing we said we need is to change those workflows, right? That you can't just change the payment system. You actually need to change how healthcare is actually delivered, that delivery transformation side. So fast forward now 7 years, right? And in kind of lurches, right? The system has gone digital, right?
Right, which was the original, for step one, digitize.
And there are now more and more pockets where the business case for the organization has really flipped, and we're creating those pockets and expanding those pockets for the independent primary care docs. The work that still remains is the actual work of transforming how care is delivered and the culture that goes with that. Right. So, I think that we have made tremendous progress, but there's so much work yet to be done, and that's kind of why I'm excited about it.
So what are those pockets right now? What are the big opportunities, or where maybe is the transition to value-based care a little bit easier maybe than other places?
What we thought was, look, it's really hard to have someone lose money as they're transitioning from volume to value, right? There are some organizations who are doing it, who are saying, we're going to take losses as we reduce our hospital bed count. We're going to shrink this part of our organization, which may be high margin today, but honestly, we're doing too many proton beams or whatever, right? There are a few organizations like that who are doing it. But the group that I'm most excited about are who do you need more of their services as you go from volume to value? Who? Right? It's primary care, right? Like the only thing that you need more of, actually, is primary care.
And maybe telemedicine.
But you know what? You can't just throw telemedicine at it or telehealth at it, right? Fundamentally, it's about you need more prevention. There's lots of point solutions, right, that are going to need behavioral health and care management and diabetes and patient engagement tools, right? All of those will come, but the fundamental question is who in the healthcare system who has influence today do we need or can be that fulcrum around which it turns? And for us, it's primary care.
And of course, a lot of that transition then is based on really capturing a lot more information about an individual patient. Not just the population level.
It's not just capturing it, it's actually making it actionable. Making it actionable, creating insights.
So last year at HIMSS2015, you made kind of a big splash when, certain elements of providing data to patients were taken out of meaningful use, and they stayed out for the most part. Now, though, there seems to be with the Office of Civil Rights within HHS has made new guidelines.
Yeah.
Is that a step forward, or where are we at with actually giving patients more access to data?
And look, by the way, I am wearing my Regina
holiday.
A couple of times a year where I get to wear it. The president, when he spoke at the Precision Medicine Initiative last week, what did he say?
He said, I would like to have access to my data, and I would like to think I own it.
The President of the United States. Right.
Yeah, that's great.
Right. And there's a lot that's happening now with the existing levers that we have, with the Office of Civil Rights, with certification, with APIs, right? We are in a different place here, too, than we were 3, 4, 5 years ago, where people were saying, what are you talking about, the patient's record? It's not the patient's record, it's my health system's record, and why does the patient need to see it, right? We have totally changed that conversation. I do think that people need both access to their information, but also things to do with it once they have it to really make this whole kind of virtuous cycle kick into high gear. We do need to work on the demand side. We do need to have more people actually asking for their information.
So what's the secret there? How is it going to become more valuable, or how do you get, is it PR to drive more knowledge of this?
Yeah, the government's really good at PR.
What is the killer app? There have been some incidents that we've been good at, but what is the killer app for patient access?
One of the things that I'm actually think was pretty interesting is this collision of the worlds of precision medicine and the moonshot and the data liberation piece, right? To tap into altruism, to say, you know what, this may not help you, but it can help society. So get your information, link it to, donate your genomic information, donate your clinical information, donate your phenotype. Let's get 100,000 or 1 million patients who've donated their information for science. I think that can certainly spur action. For me, the one that I'm actually I think this could be kind of a sleeping dragon, would be if the tools that we use every day were to become smarter with knowing who we are. So when I do a search for a hospital, or for a knee, I'm like, knee pain, maybe Google, with the privacy protections that needs to happen for Google to feel safe doing this, and for us to feel safe letting Google do this. Maybe they should know my medical history already. Maybe they should know who my doctors are. Maybe they should know who my insurance company is. So they can tell me, oh yeah, I'm going to pull from here the surgeon's scorecard for knee replacement complications.
Maybe they don't know, but they're an agent within the system, something like that. Right.
So agents who will help people. Right. And one of the things I think we do need to clarify, and coming back to the OCR issue, is the rights of non-covered entities and the protections for people when those non. Because what we don't want, is to have kind of your health information willy-nilly be out there and everyone using it and monetizing it. I think there's a lot of legitimate concern around that.
Yeah, absolutely. So is there a solution for real patient ownership where it's not just out there? Have you seen anything that looks compelling on those fronts?
I still think that we're in the early stages of this, of creating actionable insights for people. I do think that the opportunity is around consumerism. Again, changing the business models, where we're picking health plans. What's the right health plan for me? The fact that I go on an exchange, I chose the health plan for my Part D drug plan for my dad. I'm a doctor. I had his list of meds. It was incredibly painful, and I think probably like 70% of people, I chose the wrong plan for him. 70% of people choose the wrong plan for him, So more and more people are going on exchanges, choosing plans for themselves. Shouldn't that decision, that portability part of HIPAA, shouldn't that be accompanied by a decision support tool that knows who your doctors are so that you don't get onto the wrong narrow networks, that knows what your conditions are so you don't get something that's not covered, knows what your medications are, That's just obvious. If I'm looking for a knee replacement or I'm looking for a procedure, what network of doctors should I go to, So those are, to me, as we get more consumer-directed health plans, as we get high deductible plans, as we get more exchanges, the consumerism, I think, and servicing individuals, instead of our whole insurance industry has been focused on servicing companies, and now we're going to have to start to service individuals, That, I think, is going to be the big change maker.
And what about one last question about Get My Health data?
Yeah.
Where do you see that going in the next? Is that part of this?
I mean, certainly, Get My Health data is saying let's make it easier for people to cross the river. It's incredibly difficult for people to cross the river today. And I think the idea of having, in particular, tracers, people who volunteer and say, I'm going to ask for my data, and I'm going to report back, and I'm going to try to be the expert who navigates through that maze and calls the Office of Civil Rights and calls ONC, and I will be the icebreaker on that path. I think that's an incredibly valuable effort, and we need more tracers.
Great. All right. Thanks. This is Leonard Kish with HealthIT TV with Dr. Farzad Mostashari, and thanks for talking with us at HIMSS2016.
Thanks, everyone.
Take care.